Now, Gill sees the opponent's use of the doctrine of double effect as extremely problematic. He provides a variety of responses to show the unsatisfactory nature of this doctrine in regards to PAS. Um, However, I want to focus on what I think is his most important and his strongest line of response, and that is this. Remember that in order for the doctrine of double effect to apply to one's action, that action must produce both a good effect and a bad effect simultaneously. If an action only produces good effects or only produces bad effects, then the doctrine of double effect simply does not apply. And according to Michael Gill, when a physician participates in PAS, there are no bad effects. In other words, the death of a terminal patient is not a bad effect. Number one, because that patient desires to die to participate in PAS. And number two, from a more objective standpoint, the remainder of that patient's life is not going to be positive, as Gill has already argued. Terminal patients have generally made all of their big autonomous choices, and the remainder of their life will just be filled with suffering. Therefore, when a doctor prescribes a lethal medication to a patient so that they can commit suicide, that action only has a good effect, which is the minimization of pain and suffering of that patient. Yes, the patient dies, but that result, that effect is actually a positive effect. It's a positive consequence because forcing or making that terminal patient remain alive would only entail more suffering. Therefore, playing a role in that patient's death is not bad. It is not negative. So the doctrine of double effect doesn't even apply to PAS cases when they are properly conducted.